Good day everyone, my name is Princess Venzuelo, a leader in the group 15. So today we will discuss about the fracture, bandaging, and splinting. So my other co-members and me will discuss the definition, the causes, the signs and symptoms, the treatment management, the lab test or lab exam, and the nursing responsibilities. So I hope that you will learn something from our report. So let's begin.
Hi, my name is Karen Tigi. So, what is fracture? A fracture is a break, usually in the bone. If the broken bone punctures the skin, it is called an open or compound fracture. Fractures commonly happen because of car accidents, falls, or sports injuries. Other causes are low bone density and osteoporosis, which can cause weakening of the bones. Basics of bone fracture. There are several types of bone fractures, and each type can have slight variation. Many of the types of fracture we'll talk about later may also be described by one of the following terms. First is open fracture, a fracture in which the bone breaks through the skin and can be seen outside the leg, or there is a deep wound that exposes the bone through the skin. This is also called compound fracture. And then the closed fracture. A fracture does not break the skin. This is also called a simple fracture. Partial fracture. An incomplete break of the bone. Complete fracture. A complete break of the bone causing it to be separated into two or more pieces. Stable fracture. The broken ends of the bone line up and have not moved out of the place.
Displaced fracture.
There is a gap between the broken ends of the bone. Repairing a displaced fracture may require surgery. Types of fracture and how to immobilize. There is a range of fracture types including a transverse fracture is when the fracture line is perpendicular to the shaft or long part of the bone. A back brace called TSLO or abdominal bender may be prescribed to reduce pain by limiting motion at the fracture site. Comminuted fracture is a break or splinter of the bone into more than two fragments. Wearing a splint or cast for a while to keep a bone from moving while it heals. Compound fracture, also known as open fracture, is a bone fracture that is accompanied by breaks in the skin, causing the broken ends of the bone to come into contact with outside the environment. Fixation can be used to immobilize compound fracture by using rods, wires, pins, screws, and or plates placed to hold the bone in proper position during healing. Spiral fracture, also known as torsion fracture. It is type of complete fracture. It occurs due to a rotational or twisting force, keeping the bone immobilized by using clean casts for a period of 4 to 6 weeks. Avulsion fracture is an injury to the bone in a location where a tendon or ligaments attaches to the bone. Crutches may be used for a few weeks for fracture in hip. An avulsion fracture to your foot or ankle may be require a cast or walking boot. Impacted fracture occurs when the broken ends of the bone are jammed together by the force of the injury. Immobilization of the injured is done by using splint or cast. Torus buccal fracture is a type of broken bone. One side of the bone bends, raising a little buckle, without breaking the other side of the bone. Splint is used to immobilize and makes normal daily activities. Green stick fracture is a crack or break on one side of a long bone in the arm or leg that does not extend all the way through the bone. In most cases, immobilization is done with a cast or splint. Oblique fracture are complete fractures that occur at a plane oblique to a long axis of the bone. Screws and circlages may be used to immobilize fracture.
So again, I am Princess Venzuelo. I will discuss the causes of fractures. So the most common causes of fractures are the trauma, the osteoporosis, the overuse, the direct blows, crushing forces, the sudden twisting motion, and lastly the extreme muscle contraction. So first let's discuss about the trauma. So trauma, a fall, a motor vehicle accident, or a tackle during a football game can all result in fractures. So why is that trauma belongs to the causes of fracture? So let's discuss about it. Let's explain furthermore. While bones are very strong, they can break. So most often breaks happen because the bone runs into a stronger force, like getting into the car crash, like getting thrown to a car crash. So also repetitive forces like from running can fracture a bone. So healthcare providers call these types of injuries stress fractures. So let's proceed to the second one, osteoporosis. So osteoporosis, this disorder weakens bones and makes them more likely to break. So osteoporosis causes bones to become weak and brittle. So brittle that a fall or even mild stresses such as bending or cuffing can cause a fracture. So osteoporosis related fractures most commonly occur in the hip, wrist, or spine. So bone is living tissue that is constantly being broken down and replaced. So the third one, we have the overuse. So overuse, repetitive motion can tire muscles and place more force on a bone. This can result in stress fractures. So stress fractures are more common in athletes. Other causes of fractures are direct blows. A bone is subjected to more stress than it can absorb from an impact with a solid object, as from a baseball bat or a crushing force, so such as some automobile accidents. Crushing forces. A crush injury occurs when the body or a body part is dropped, pinched, or jumped between objects. So a vehicle run over a passenger can fall from a tractor or other farm vehicle and be crushed beneath the wheel. So a crush injury occurs when force or pressure is put on a body part. So this type of injury most often happens when part of the body is squeezed. So nag-cite na ko example kanina narapod sa um, ato ang report. So muna siya one of the example of crush injury. So we have the sudden twisting motion. So why is it sudden twisting motion belongs to the causes of fracture? So let's discuss about that. In a twisting or torsion fracture, an indirect force may cause a break in a bone at a location other than the site of the twisting force. So twisting injuries sustained during sports, like during a physical attack or in an accident. So other explanation about sudden twisting motion is that twisting or pulling a muscle or tendon can result in a strain. So it can also be caused by a single instance of improper lifting or by overstressing the back muscle. So a chronic or long-term strain usually results from overuse after prolonged or repetitive movement of the muscles and tendons. So we have the we have the last one, the extreme muscle construction. So extreme muscle contractions is a condition in which muscles stiffen or tighten, preventing normal fluid movement. So the muscles remain contracted and resist being stretched, thus affecting movement, speech, and gait.
Good day everyone, my name is HERMOSA VIDAL and I will discuss about the signs and symptoms of a fracture. The signs and symptoms of a fracture vary according to which bone is affected, the patient's age and general health, as well as the severity of injury. However, they often include some of the following. The first is pain. In the injured area that gets worse when the area is moved or pressure is applied. Both the fracture and any injuries to the body tissue near the fracture site can produce pain. Second is swelling. Is the result of the increased movement of fluid and white blood cells into injured area. Muscles that surround the injured area may go into spasm when they try to hold the broken bone fragments in place, and this spasm may cause further pain. The third is bruising. The discoloration of an injury shows that blood has escaped from the capillaries in the area, which means the tissue has been damaged underneath, including blood leaking from the broken bone. Fourth is angulation. In orthopedics, a method of describing the alignment of long bones that have been affected by injury or disease can be described in both anteroposterior and lateral planes. Fractures angulation describe a specific type of fracture displacement where the normal axis of the bones has been altered such that the distal portion of the bone points off in different directions. 5. Redness. An infection after fracture will usually cause increased pain, warmth, redness, and swelling around the affected area, more than what is considered normal. 6. Deformity. After a bone is broken or fractured, the body will start the healing process. The body part may appear deformed due to the displacement of the bone, the unnatural position of the causally or angulation where there is no joint. For example, the causality forearm is bent instead of straight. 7. Crepitus is a common sign of bone fracture. Crepitus can easily be created and observed by exerting small amount of force on a joint, thus cracking it. This is caused by bubbles of nitrogen forming the synovial fluid bursting. 8. There will be feeling of dizziness. 9. Feeling of sickness and nausea. Some people really feel dizzy or sick as a result of being shocked and trauma of breaking a bone. That's all. Thank you.
Hello, my name is Fatima and I will discuss the laboratory or diagnostic exam. So, doctors will closely examine the injured area for tenderness, redness, and swelling and will order diagnostic imaging tests to determine what type of treatments appropriate. Diagnostic testing for fracture may include like X-ray, CT scan or computed tomography scan, or MRI, also known as magnetic resonance imaging. MRI, some fractures such as stress fractures don't show up on the x-ray until a few weeks after the bone starts hurting. An MRI can pick up the smaller fracture before they get worse. So we also have a bone scan. So we will proceed to treatment and management. If first aid or nursing aid you suspect a bone fracture, you should keep the person still. Do not move them unless there is a immediate danger, especially if you suspect fracture of the skull, spine, ribs, pelvis, or upper leg. The next is attend to any bleeding wounds first. Stop the bleeding by pressing firmly on the sites with a clean dressing. If a bone is protruding, apply pressure around the edges of the wound. So para dili mo grabe ang iyahang dugo, dili mo daghag gawas. So next is, if bleeding is still controlled, keep the wound covered with a clean dressing. Musa mo ito buhato nimo, tambunan nimo siya tong clean dressing. So never try to straighten broken bones. O di na, if na mo sa situation ing ana, never touch the broken bones kay na ay tendency na musamot og kapiang. So for a limb fracture, provide support and comfort sa siya below, under the lower leg or forearm. However, do not cause further pain or unnecessary movement of the broken bone. So dili nimo siya pwedeng biklon sa nimo in case wala pa emergency or ambulance maabot. For a limb fracture, provide support and apply a splint to support the limb. Splints do not have to professionally manufacture. Items like wooden boards or folded magazine can work the some fracture. You will embolize the limb above the below the fracture. Have you see that on hospital ka na? Parang makakita mo na yung tao na but pareha sa dextrose na ibutang nila dere. Tawag ana niya is folding magazine or wooden board para mo balance siya dere. Mostly ibutang po na ni ila na gina-apply ka ng naipiang para magtarong siya. Next is use a sling to support an arm or collarbone fracture. Katong ginagamit nila mostly makapalit nakasulay ko ana pero diri sa arms nako atong sa arm nako ipapalit mi atong kuan sling siya na sling arm. Next is raise the fracture area if possible and apply a cold pack to reduce swelling the pain. So next is stop the person from eating or drinking anything until they seen by a doctor in case they will need surgery. So dili na to patakag pakaon ang pasyente or like a patient like that na walay order sa doctor. So it's mas importante kung mangutana siya sa doctor. So in case inganang na sitwasyon, you can call ambulance lang and wait. So let's proceed. Next is treatment will be based on the type of fracture, severity, and your child's age. In most cases, fracture in children are treated with a sling, splint, brace, cast, or walking bolt. Their immobilize is injured bone, it heals. So we have the boot. Boot is a broken ankle, foot. Boot mo na siya ginagamit sa broken ankle, foot, or leg may be stabilized with an air cast boot. The air cast boot immobilize the foot and ankle but can be removed for batting or icing under certain circumstances depending on the severity to break the stage or healing. It may be okay to remove the boot for the short period for icing or batting. Next is cast. Casts are stronger than splint and provide more protection to the injured area. Casts have two layers, a soft inside layer that rests against the skin and a hard outer layer that protects the injured bone and prevent movements when the bone heals. The type of cast used will depend on the type of fracture. So, next is we have reduction. A reduction is a non-surgical procedure to set the bone so it will heal properly. The doctor realigns the broken bone from outside the body and put the injured limb in the cast of or splint. Reductions are usually performed in the emergency department with medication that manage pain and make your child sleepy or sedated to their so they won't remember the procedure. So patulogon sa sila. Next is surgery. Severe or unstable fracture that can be set properly with a reduction requires surgery. To increase the chances that the bone will heal in the correct position, your child's doctor will decide every early in the treatment whenever they operate in some cases. However, it is area around the fracture is swollen. The procedure may have to wait until the swelling goes down. So, muna siya ikuhan. Then, we have the other treatment, like traction. Uses a gently steady pulling motion, is a specific direction to allow the ends of the broken bone to align and heal. In some cases, traction reduces painful muscle spasms. In medication, is sometimes used to help to control pain and muscle spasms if a fracture is open. Antibiotics are used to prevent infection too. So, let's proceed to the next topic.
So what is bandage? Bandage is any gauze or cloth material used for any of the purpose to support or to hold or to immobilize the body part. Bandaging is a technique of application of specific roller bandages to different parts of body. Purpose of bandaging: to control bleeding by pressure, to immobilize sprain or fracture limb, to hold a dressing or compress in place, to secure splints in case of fracture of deformity, to protect open wound from contaminants, to provide support and aid in case of varicose veins or impaired circulation. Types of bandages. Circular bandage. The bandage is wrapped around the part with complete overlapping of the previous bandage torn. Spiral bandage. The bandage ascends in a spiral manner so that each torn overlaps the preceding 1 by 1/2 or 2/3 the width of the bandage. Figure of 8 bandage. The figure of 8 torn consists of making oblique overlapping torns that ascends and descends alternatively. Recurrent bandages are used for gingers for the hand and for the stump of an amputated limb. T bandage. It is used to secure rectal or perineal dressing.
So what is splints? So splints are also used for minor fractures that don't require a cast. So splinting is a technique to immobilize a broken bone. So in further explanation, splints are made up of a leather casts that were separated by slim wooden slots work to repair the fracture and realign the bones. So the purpose of splinting. So the purpose of splinting is temporarily immobilize limb for pain and spasm. Second, to decrease swelling. The third one is to minimize further potential soft tissues are neurovascular injuries associated with confusions, sprains, lacerations, fractures, dislocation, or painful joints due to inflammatory disorders. So we have uh, the types of spleens. So these are the following. So first, we have the ulnar gutter spleen. So ulnar gutter or boxer is an ulnar gutter spleen, a flexible spleen that is used to support, stabilize, and immobilize injuries, dislocations, and fractures of the hands, fingers, or wrist. So the ulnar gutter spleens is useful for fractures and severe sprains to the bones of the ring and small fingers. So the ulnar gutter spleens extend from the upper part of the forearm to the last joint of the fractured finger. So the second one, we have the volar spleen. So what is volar spleen? So volar spleen is a non-circumferential shell of plaster used to temporarily immobilize fractures and soft tissue injuries of the forearm and wrist. So the purpose of volar spleen is to minimize movements and provide support and comfort by stabilizing an injury of the palm or foot. So, ang ulnar spleen is for the fingers or katong sa ring of fingers. Then, ang volar spleen is sa palm or foot, which also reduces pain and helps the injury heal faster. So, spleens are usually applied to the reduced movement and provide support and comfort by stabilizing an injury. So the third one, we have the thumb spica splinting. So I will not read the definition because I will just discuss it. So the thumb spica splinting is a vital that the splint allows for balance function and maximal mobility of the unaffected areas such as fingers, upper arm, and shoulders. So muna siya thumb spica splinting. So maapin na imong fingers there, then na imong upper arm o nga imong shoulder. So kung sa ulnar kuan aning ang ma-applied is the fingers only, but the volar spleens is for the palm and foot, and then the thumb spica splinting is for the fingers and upper arm and shoulder. So the last one, not the last one, we have the sugar tongue spleens. So the purpose of sugar tongue spleen can be used for fractures distal to the proximal tibial metaphysis or for grossly unstable fractures above the ankle. So for additional control and stability, a posterior slab can be added to the spleen. So this can be either fiberglass or plaster over abundant padding held in a place with an elastic bandage or bias cut for elastic bandage. So we have the ankle stirrup splint. So the purpose of the ankle stirrup splint is used for after an injury to increase comfort and limit movement. So the splint squeezes your ankle between two plastic pods. Then these pods are filled with air to cushion and support your ankle while it heals. So that is the purpose of ankle stirrup splint. So we have the knee immobilizer. So the definition of the knee immobilizer is is knee immobilizers or hinge knee braces are used to protect knees with extensor weakness after femoral nerve block to limit flexion or varus or um, valgus motion during early rehabilitation in patients with the ligament deficiencies or for repair or reconstruction of the extensor mechanism. So the knee immobilizer um, is a piece of equipment that keeps the knee from bending and is typically used after a leg injury or surgical procedure such as like hamstring lengthening. So it can help give your child a prolonged stretch and discourage your child from putting weight on the knee. So moving the knee or walking. So that is the purpose of knee immobilizer. So those are the types of the splinting. And now uh, let's proceed to the materials that can be used for splinting. So materials can be used for splinting at home are, so these are the following. So we have the rolled up newspaper. So magamit na siya nimo for splinting if wala mo na mapangita ra sa atong balay. Rolled up newspaper, heavy stick, board or plank, then rolled up towel. So motoy mga following nga makita ra sa ato ang mga balay. So how to apply splint. So you can follow the instruction below to learn how to apply splint. So attend to any bleeding. So attend to bleeding if any before you attempt to place the splint. You can stop the bleeding to putting pressure directly on the wound. So apply padding. Then apply a bandage, a square of gauze, or a piece of cloth. Then lastly, place the splint. So those are the following how to apply a splint.
Good day everyone, my name is ROSILIE VILLACORTE and I am one of the members of the group 15 and our topic is fracture, bandaging, and splinting. So today I will discuss on the nursing assistant duties and responsibilities. During fracture, the duties and responsibilities of a nursing assistant are as follows. For closed fracture, the patient with closed fracture is assessed for the absence of opening in the skin at the fracture site. But before that, I will discuss first what is a closed fracture. Say a closed fracture, it is a broken bone that does not penetrate the skin. So meaning if you are one of the nursing assistant, we should always watch out our patient if he or she got an open wound on the skin. If not, meaning that is a closed fracture. So the fracture is more on inside of the body. So if he or she got a closed fracture, meaning he or she is safe for an infection. Next is open fracture. An open fracture, it is when there is an open wound or break in the skin, and it is more prone to the bacteria from the dirts and infections. And a patient with open fracture is assessed for the risk of osteomyelitis, tetanus, and gas gangrene. So what is an osteomyelitis? An osteomyelitis or OM, it is an infection of the bone. Symptoms may include bone underlying redness, fever, and weakness. Next, tetanus. Tetanus is an infection that produces a toxin that affects the brain and nervous system. It may lead to the stiffness of the muscle. And the last one is the gangrene. Gangrene is a bacterial infection that produces tissues gassed in gangrene. This deadly form of gangrene usually caused by Clostridium perfringens bacteria. So open fractures are so prone to the bacteria. So that's why if you encountered a patient with with an open fracture, you should always we should always use gloves, because we can in that way we can protect ourselves, and also we can protect the patient. So the overall nursing assistant duties and responsibilities is we can provide relief for the patient's pain. So meaning, even though they're going through the pain, we can comfort them by talking to them, and sometimes through talking to them, sometimes they forget the pain and give them assurance. Next is achieve a pain-free, functional, and stable body parts. So if the patient got a fracture, and the rest of the body parts, we can manage them through giving them exercise, and but we can exercise them, but we have to ask for permission from the doctor, and we should always give the patient a pain-free way of doing exercises. And next is maintain asepsis. Asepsis is a microorganisms that can it is a microorganism or a bacteria that can cause swelling or any painful or any pain to the patient, so we should avoid it. Maintain vital signs within normal range. So as a nursing assistant, we should always tell our patient that we should monitor them through the time. And the next is exhibit no evidence of complications, meaning no evidence of complications that the patient is through recovery. So meaning they're not going back to the from the time that they get the fracture. So meaning healing slowly by slowly. Inspect and palpate the area for swelling. As a nursing assistant, we should always wear gloves before inspecting and palpating the area for swelling. And through that, wearing gloves, we can protect ourselves, and also we can protect our patient. So for the fracture, we can tell that the wounds are swelling by palpating. Inspect for the presence and the status of wounds. Like every day, we can check our patient by checking the wound and changing the dressing, and also making it clean all the time. Next is note for the presence of drainage, amount, color, odor, and velocity. So through checking the wound, if there is any drainage, we can always note that, and we should always report to the nurses or the doctors. Next is inspect and palpate for adequacy of circulation. Example, skin temperature, color, and sensation. So through that, we will know that our dressing, if ever we change the dressing for the wound, we will know that the dressing it if it's too tight or too loose, because we can diba because sometimes if we have the band-aid we cut ourselves, and if it's too tight, we can see that the end of our fingertip is turning into purple or sometimes blue color. So also same in the wound or the fracture, we can always check for the circulation, because if the circulation is good, so meaning that our patient also is having the feeling of pain free. So that's all for my report, the duties of nursing assistant. Thank you.
So that's the end of our report. Thank you for watching. Bye!